My name is Craig Nelson, and I'd like to take a moment to discuss two challenges that face forensic pathologists in diver death investigation. Consider two different diver deaths. In the first, we have a lobster diver who's at 40 feet, focused on hunting lobster when he runs out of air. He makes an attempt to ascend, but he's overweighted, and as a result, he drowns. Consider then a different fatality, a person of the same age, the same health status, who descends to begin hunting lobster. And a few minutes into the dive, he has some difficulty breathing. He tries changing his regulator because maybe he thinks that that's the issue. But even on the alternate second stage, he has worsening dyspnea and maybe even coughs a little bit. So he begins to make an ascent. Upon his ascent, his respiratory difficulty worsens. He reaches the surface, spits out his regulator, says he can't breathe, produces copious amounts of frothy fluid, and then becomes unresponsive. These two cases have very different causes of death. However, they're going to have very, very similar autopsy findings. In both, we expect that we're going to see pulmonary edema with heavy lung weights and abundant fluid that we see on sectioning of the lungs. And we also find extensive frothy fluid within the airways. And these two cases together illustrate two problems that are faced by autopsy pathologists in the investigation of diver deaths. The first issue is one of investigation. Many forensic pathologists have no training in diving medicine and have little awareness of the entities that they may face from a diver death. Very commonly, they see a diver who has died, the diver's wet. They know that the most common cause of death in diving is drowning, and so they say, well, this must have been a drowning death. Or maybe they have a slightly better level of sophistication and say, well, maybe this was arterial gas embolism. But in either situation, do they have the knowledge and the background to ask more questions? They don't know what questions to ask, and they don't know that they need to be asking additional questions. And therefore, they may not be aware of what other elements of investigation, such as witness interviews, scene investigation, and examination of the diver's equipment, they may actually need. The other problem that these two cases together illustrate is a lack of awareness of immersion pulmonary edema as a fatal entity. While IPE is fairly well known in a clinical setting, certainly for hyperbaric physicians or emergency room physicians, it's not something that's well known among forensic pathologists. If it's not known among forensic pathologists, it's not taught to the pathology residents or to the forensic pathology fellows undergoing training. Therefore, when a pathologist is faced with pulmonary edema and frothy fluid in the airway, the tendency is to think drowning because there simply is no awareness of IPE as a fatal entity. The solution to these two problems is fairly straightforward, and that is education of forensic pathologists about the complexities of diving fatalities. And that's not to say that every pathologist needs training in how to investigate a diving-related incident, but simply that they can be counseled to seek a little bit of additional training in order to ask experts what needs to be done. They can talk to forensic pathologists with expertise in diving fatalities. They can talk to emergency room physicians who have treated divers. They can talk to hyperbaric medicine physicians and say, these are the situations that I have. What other questions do I need to ask? How should I direct my death investigators on what to do? What do I do with this equipment that was impounded at autopsy? Of course, the most important part for the forensic pathologist is correct certification of the cause of death. And so by learning how to ask the proper questions, learning how to talk to the experts and communicate with them appropriately, even if they lack the knowledge of diving medicine that some others may have, they can appropriately guide that investigation and certify the cause of death correctly. Thank you.